being a child of the Depression, I couldn't afford to live near the college. So I was on the New York subways a lot, carrying bone boxes as well as these huge medical texts. My mother was an RN in the OR in the days of very rapid surgeries because the anesthesia wasn't very good, and sounded very exciting. You became an RN with a 3-year course in these nursing schools that were associated with most big hospitals. So my mother discouraged me, saying that nursing was very hard work, and since I liked to read, I should go to college. So I went to college, and I took a pre-med course, not because I thought even at that point that I would be a doctor, but it was sort of a very diverse set of requirements, and I thought I might be a social worker or something like that. I was sent to a college, Wheaton College, Illinois, which is a very evangelical college, and there was a lot about being missionaries and trying to persuade us to go to the mission field, etc. I wanted something much more practical, so I thought taking care of people medically was more practical. I entered medical school in 1951, and the Journal of the American Medical Association had an educational issue every year, and it showed that there was 6% quota for women in most all of the medical schools. Prior to that quota, there were fewer than 6%. So I was in a class of 150, and there were 9 of us young women. By 1951, the veterans from World War II had gotten their GI Bill and gotten through college, and they were all that were looking forward to a medical career. So there was tremendous competition to get into medical school with all the veterans plus all the other people who wanted to. So 6%, I think, was a very good advantage to me. When I was looking for fellowship, some endocrinologists in the residency where I was at Long Island College Hospital suggested that if I went to Joslin for a year and came back, that I could be a part of their practice, and that appealed to me very much, being on my own as a woman in an age when there weren't very many women physicians. But of course, when I came to Joslin, I never got back home. I had no mentors before I came to Joslin, and had Dr. Priscilla White. The fact that here there were the 2 of us for a while, and then later more, it was still difficult. I recall in the first few years that I was here, when a new patient would come in who was a man, they mostly all would explain that they were asked at the front desk, would they be willing to see a woman physician? And they, of course, said, so I'm broad-minded and I'm here and I'm glad to see you. But that was, I don't know about all the ones who said no, but in fact, in the first decades that I was here, I had patients who didn't have diabetes who were referred by their physician because they were women who wanted a woman physician. So that was the opposite of the men who came in. So I did, but it was, they couldn't find any other woman except a diabetic specialist. I do consider that one of my significant contributions to Joslin is that I insisted that they have pediatricians, and so now we have just a wonderful pediatric department that does wonderful things for kids. Later in my career, I was taking care of people I had known since they were 5 or 12 or whatever, and here they were, adults with full lives, with all the things that go on in education, career, family, and so forth. And with the patients that I had taken care of, the medical aspects during their pregnancy, we would sit and ask about their grandchildren. So that was a very complete way of relating to people long term. Having the opportunity and the longevity to be a part of this field that has led in general medicine in the care of chronic disease. That's been my main satisfaction, is to be a part of all of that, to personally involve myself in that. That's why, even though I'm not seeing patients, I still come. I still think that being a part of it all is important to me personally. When I started, many women were told elsewhere, not here, that they couldn't have a family, that they shouldn't have a family, that it's dangerous, risky, and whatever. Now care is widely available. The obstetricians can do much more than they could do, and that was part of the advance in the outcomes for women with diabetes as well as the general population. So they can have a full life as far as the family life and educational or academic goals or career goals, or, you know, if they want to be an artist with a irregular life. You used to have to be on a very rigid time schedule to manage diabetes successfully, but with the continuous glucose monitors and with the insulin pumps and so forth, people, women as well as men, can adapt the treatment to what their preferred lifestyle is.